I genuinely believe that it's because of ADHD that I've been able to turn my life around.
Yeah.
I think it's given me a resilience that I wouldn't have.
Originally this was about boys, then it was only about children.
Very true.
And now it's about adults and children. ADHD doesn't respect gender.
The first of all, there was like a grief period of, oh God, I've had this my whole life and nobody spotted it. I know I've been different and I know there was trauma there, but I knew it was more than that.
There is a cost of not treating ADHD, and it is far higher than the cost of treating ADHD.
That's what I'm picking up, you know, there's a cost of missed opportunity in life.
This isn't about belief systems. This is not a religion. This is a biological thing that we're talking about here. So we need to be a bit more on the ball with that. And also, if the teachers are saying, well, I have to have the piece of paper, it shows you how broken the system is.
Children with ADHD do not have learning difficulties.
Yeah.
They have difficulties learning. And it's for the system to change. Don't apologise for having ADHD. You're different. We've got to shift the whole optics on how we look at this.
Ella McCrystal, welcome to ADHD Beyond the Label.
Thank you for having me both.
Pleasure.
I know a little bit about you.
Yes.
I don't know everything about you. One of the things I want to talk to you about is in relation to your ADHD.
Yeah.
Where would you say that as a young girl growing up, you were a typical girl with ADHD?
Well, I'll start with some of the more kind of difficult ones to talk about. I mean, I had some of those behaviours that you would consider to be risky behaviours. So some of them would have been, you know, I was a little bit cheeky with the old stealing and, you know, lying, but also always very, very hyperactive. So I couldn't, if there was an opportunity for me to make up a song out of nothing, I would do that. And I was quite obsessed with things as well. So if I liked something, I needed to do it over and over and over again. I couldn't just do it once. I needed to do it as many times as humanly possible until I was bored. Then I'd move on to the next thing. So, I mean, you know, even things like teenage crushes. I had a massive thing for Andre Agassi. Like, I couldn't just have one poster. The entire room looked like something from a stalker's bedroom. You know, those kind of wildly absurd, over-the-top things. But also just a lot of self-esteem issues, like really quite intense self-hatred. But, you know, one of the things that is quite confusing for a lot of people, I think, is that I think ADHD and trauma are pretty much part of the same parcel. And I kind of felt like that my whole life, that I was a bit like past the parcel. You never knew what you were going to get. Is it trauma? Is it ADHD? And it's only recently that I've found out that it's both.
So 2 years ago, right? You got diagnosed.
Yeah.
And were you misdiagnosed before that? There's a story that...
Complex PTSD, yeah. And, you know, to go into that briefly, but as succinctly as I can, I was sexually abused by my dad over several years. By the age of 11, he was in prison. Admitted it, so took a lot of that off me. I didn't have to kind of go through the proving that I was telling the truth bit. And then he went to prison, and 30 odd years ago, social services really didn't get involved, and he was able to move back into the home. There was violence involved in that as well, which, you know, his emotional regulation was not good. So I assume and maybe believe that there might be some ADHD with my dad as well. So
it is hereditary, right?
Yeah, it is 80% hereditary.
Yeah.
So mum or dad biologically,
yeah.
and you've described that in your dad. Bring it back to you for a second, if I can. I went straight in with a pretty hard question there, but what that's exposed is a young girl, lady growing up with many layers of vulnerability.
Yeah.
And we talk about the manual, the psychiatric manual about inattention, hyperactivity and impulsivity, and, you know, it's basic nonsense, isn't it? What we're dealing with is a very vulnerable person, and being sensitive to rejection, and sort of emotional dysregulation within yourself, and you're sort of cheeky with stealing, and those kind of things. Where were you as a young girl? And I'm asking this question for the young girls that are going to watch this, or I hope will watch this, to have empathy with them and demonstrate the empathy from your life. Yeah. Where were you with things like emotional dysregulation and sensitivity to rejection as you were growing up as a teenage girl, undiagnosed with ADHD?
Awful. I mean, I think the assumption was that and it would be said a lot to me, that I would need help, but the help wasn't available. I was a chronic self-harmer, and ended up in stitches on more occasions than I can count. And the way that I would deal with emotion was to become wild with rage. I think some element of that was that the people around me were not safe people all the time, but also I knew there was something wrong with me. I say wrong, I now know it's not different, yeah. But at the time, that's the only word I would have been able to have. I just couldn't contain. It was like a pain that had to come out. And I think, unfortunately, with that dopamine issue around ADHD, the self-harm became quite addictive because, well, first of all, I'm expressing an emotion, but second of all, I'm getting the dopamine as I release the blood. So I'm sort of killing two birds with one stone. And yeah, I would say I was wild, and I've often described myself as a wild animal. And just not having a safe space or no one was teaching self-soothing techniques back then. In fact, when I went to the doctors, I would be told that I was wasting their time. So, I mean, we weren't looking at girls with ADHD then, were we? We just weren't. So complex PTSD actually was still quite late as a diagnosis. I think they just thought I was an angry time waster, if I'm being honest. That seems to be what I was getting fed at the time.
If we fast forwards then, you've gone through life, and here you are now sat in front of me as a successful person, and you can feel that success in you, if I can be that bold. But what was the switch? What turned that around for you?
I think I'm a psychotherapist, to give context. Yeah. So I think one of the things that really helped me was a curiosity. So that kind of obscene curiosity you have with ADHD, the explorative side of it is just, like I said earlier on, that almost obsessive nature that I have. I found something that I really wanted to do, hence me mentioning the fact that the help just wasn't there. I kind of wanted to step into that space and make a difference somehow. And I think going through the psychotherapy training and then all the sort of professional development you continue to do, it was really a bit of an eye-opener, and then having to have therapy as well. But if I'm being honest, I wasn't honest. I had to have therapy and I had to have supervision, and I found it really hard to be honest about who I was because there was so much shame attached to it. But learning about things and then meeting some of the amazing patients that I've worked with as well was such a turning point, because I had so much compassion for them and so much love, like genuine love. And I felt that they were so brave and so wonderful. And there was just a moment of realisation that the reason I feel this so intensely is because I'm seeing that mirror.
It's empathy.
Empathy.
Probably therapy, not just for them, but actually for you, because by going into psychotherapy, you're learning.
Yeah.
So you're not just satisfying curiosity, but actually you're able to piece this together for yourself.
Yeah, yeah.
I mean, just taking that, you've got your own lived experience, and then you've got your professional knowledge, if you like, and that comes with all the pooling of information you get from all your clients and all the people you speak to. Are you now in a position where you might be having a conversation with someone and then you actually turn around and say, have you been checked out for ADHD?
Yes.
Because you've probably got a massive barometer for it now.
Huge. And the thing is, people always say that. I can't remember who told the joke. As soon as you've got ADHD, you're diagnosing everybody else because you just see it immediately, right? But
you know what to look for.
You know what to look for. And I feel like people with ADHD and autism are attracted to me because there's an energy, isn't there? We kind of just have that magnet vibe, I guess. And I have an ADHD assessor, forensic psychologist at the clinic. So, I think out of all the people I've sent, I think there's 2 people that have actually, she's done the initial assessment and said they're not, they're either bipolar or something else. And everybody else, she's gone, you were spot on. She says, you're just on it all the time. So, but I think that leans into another conversation, which is, everyone's saying, oh, everyone's got ADHD. And it's simply not true. People are seeing versions of something on social media and saying, I think I've got ADHD because I've got a messy bedroom. Well, that's true. You probably do have a problem with organising. But I think it's quite important to be quite specific with it, because when I found out, first of all, there was like a grief period of, oh God, I've had this my whole life and nobody spotted it.
Classic Kubler-Ross, isn't it?
It is, yeah.
Up and down that curve.
Correct.
Yeah.
And also a couple of years before, my mum had basically told me that she'd never liked me. I'd always been too much and she wanted nothing more to do with me, ironically, considering the way that they'd parented me. So that was a bit of a hit. And it just made me think, I know I've been different and I know there was trauma there, but I knew it was more than that, because alongside the sort of negatives of ADHD, which I've said, the stealing, the lying, and all of those things that are quite shameful behaviours, I genuinely believe that it's because of ADHD that I've been able to turn my life around and not stay in the pit.
It's about channeling, it's about positioning it in a positive rather than negative.
I think it's given me a resilience that I wouldn't have if it wasn't for ADHD. I genuinely believe that, because I've got such an escapist mind, and I really enjoy. We were saying about loving what you do. If I love what I do, that is my hyper focus, and it brings me joy. Yes, I've probably got elevated cortisol levels and all that jazz, but I'd rather have that with the joy than be bored, and I don't get bored.
So let me take you back to school.
Yeah.
You've got all that traumatic life going on, but there's still a young lady at school trying to achieve an education. How did you do at school? I genuinely don't know the answer to this question. Yeah. How did you do at school?
The things that I loved, unsurprisingly, I did well in. The things that I didn't like, which were math and science, I did not do well in. Numbers for me is a massive problem. It gives me panic. I can't do numbers. I can count to about 10. Then after that, it's all very confusing. But the kind of logic, strategy, structure, when it comes to anything complex, is above and beyond.
So what were the subjects you liked?
English,
Yeah.
art, history, religious studies.
Creative.
Yeah. And business studies.
Creative and curious.
Yeah. And again, no surprise. And when hopefully teenagers are looking at this dialogue that we're having here, you talk about, if you really love something, you can get passionately into that and hyper focus on it. And we have to be careful with the use of that word, don't we? Because that can become a limiter to life, not just a positive in that moment. But the dopamine hit, instead of hurting yourself, you're now getting your dopamine hit out of doing good for other people and the work that you're doing. And I think it's really interesting to track that educational piece. You were good at what you liked, but couldn't do what you didn't.
Yeah, I literally couldn't and can't. And it's still like that now. If I'm on the laptop and something's not working, I'm just immediately like, I could literally throw this out the window. Yeah. I'm pressing the button 100 times to make it work. Literally not a good look. Yeah. But I think the other thing that was going on at school was I was incredibly overweight. Like that was food and binge eating. That compulsion was the biggest bugbear of my entire life.
Do you know, I don't know if the camera caught my smile then when you said that. And the reason I smiled is because that should be in the manual, especially for girls, but not exclusively. Not being able to eat healthily, not being able to, self-loathing and then eating and then loathing more and then eating more in that cycle. I'm putting words into your mouth, but from what we've talked about, that's where you were. And I look at you now and think, well, how could you ever have had a weight problem? Yeah. And again, one of the unseen things of ADHD is carrying weight through poor diet, poor lifestyle, and low self-esteem. Yeah. And we've talked many times, haven't we, about the connectivity between ADHD above the neck and ADHD below the neck. And there you are as a woman describing carrying excess weight probably because of your ADHD.
Yeah. The way you're thinking creates bad thoughts, which creates bad habits, which then becomes
bad thinking,
bad actions.
Yeah. But literally, I couldn't control it. Yeah. There would be times, and I joke about this, and it's not really to make a joke of it, except for it's probably the only way I can tell you. I used to work in a cake shop, and at the end of the day, when all the cakes were left, there'd be like 14 cream cakes left. I would literally take them all and eat them all. I'm not even joking. I couldn't stop. I laugh now because I could barely eat one. But
this fascinates me. So that correlates to that. I'm the dad of 2 teenage daughters. If someone's watching now, whether they're teenage or an adult, and listening to that, and they can identify with that, what did you do to break that habit? What did you do as coping mechanisms and habits to build away from that? Because that's a horrible cycle to be in, right?
Awful.
And you've been there.
Yeah.
How did you get out of it?
Well, one of the things I had to stop doing was secret eating first, because that was the whole secret thing. That's why I mentioned the lies and the stealing as well. Like, I don't know how much that was linked to conditioning from being told not to tell what was going on at home, or whether that's an ADHD thing as well. But I think the risk element of keeping secrets could well be the dopamine thing. But the secret eating had to stop first. So I would literally eat in public toilets, because if I wouldn't eat say you were all having lunch now, I go, no, I'm not hungry. And I'd go and sit in a public toilet and eat. And then I'd come back and you'd be like, oh, have you had food? Oh, no, I haven't. There was such shame around food. So that was the first thing that had to stop. And I recognised that, because the only way to not binge eat was to not do it secretly, because you're never going to eat like that in front of anyone else, because it's such a insane thing to look at, someone just shoving food endlessly in their mouth. So I realised that, and then also just talking about it. But it didn't stop straight away. It took quite a long time, and it was really up until my early 30s that it was still a real problem. And we're talking like so many calories in one go. And sometimes I'd make myself sick, but others I wouldn't. And I think it also became a bit of a sedative as well, because you eat that much sugar, it knocks you out. You've got no choice but to...
It slows everything down.
Slows everything down.
And who did you talk to? Because we obviously know that you couldn't talk and wouldn't talk to your dad.
Yeah.
When your father was let out of prison, your mother took him back.
Yeah.
So, the relationship with your mother is not one of support.
No.
Who did you reach out to and talk to?
I didn't really. I mean, at that time, I think unfortunately, everybody kind of knew what was going on, because it came out quite publicly. But there was a big push around me at the time, which was my mum and dad's friend. I mean, they're in their 70s, so they kind of wanted to support them. So it was very much a case of, you've got to forgive him. This was the message over and over again. So anyone that was around me in that ecosystem was of the mindset that I had to forgive him. So that was what I learned to do. And so in a way, though, I have to say that it's probably been a bit of a blessing, because it's made me really understanding of some of the more darker psychological problems that people have. I can understand them. I talk about that obsession, but if you're forced to forgive someone that's done something, you have to find a way of understanding that behaviour. Otherwise, you can't live with it. I mean, I left home at 16 because Boxing Day, ironically again, he was violent again. And it was not pretty. And I just thought, that's it, I've got to get out. And then I turned to alcohol. So I left home and drinking, because the pub was like literally 5 minutes away. And obviously alcohol is something that a lot of people with ADHD, I think, use to self-soothe.
Shift the lens just for a second then. You go in there. Let's just pull back for a second. Shame.
Yeah.
Young girl, ADHD, but not knowing.
Yeah.
And you've used the word shame.
Yeah.
And one of the missions we've got here by doing these programs is to rid ADHD of shame.
Yes.
Don't apologise for having ADHD. You're different. And there's a core message. We've got to shift the whole optics on how we look at this. And there'll be, I'm anticipating there'll be teenage girls, young women looking at this, feeling that shame.
Yes.
And what have you. And how have you come up, because here you are proudly, if I may, talking about your ADHD and getting a diagnosis late in life. How can we help other young women following your trajectory, hopefully not as traumatically,
Yes.
And that's one of the goals as well, isn't it? But how can you help young women rid themselves of shame, do you think?
One of the things I live and die by really is to be completely vulnerable and authentic. Because I think one of the things that we struggle with, and this word, or especially authenticity, is overused and not fully practiced by a lot of people. And one of my missions is to be here now healthier, to say, look, I see it, I get it, I hear you. It is difficult to go through this if you don't have a support system. But actually, if you're willing to say, these are the things I'm struggling with, it might be that you're struggling with your sexual relationships, or with alcohol, or with food, or with whatever it is. If you tell people that you really genuinely trust, and that's a difficult thing to do, often therapy or coaches or your best friend. If you're willing to be authentic, what you're going to learn is who's really there for you and who's not. And I think when you start to really be brave enough, and it does take bravery, it cannot be denied, you've got to be brave. And if you don't have a good support system around you, it's finding ways to build that. Once you've got that and you can be truly like, this is who I am, there is an insidious side to all of us as human beings, right? So everybody here in this room, whether we want to admit it or not, has probably lied, cheated in some way, been selfish, whatever it is, we've all gone through something. And so once you realise that everybody's the same, whether you're 13, 16, 21, 46, it's just to go, like, I'm part of the same crew. Like, let's stop pretending that we're something that we're not, because it's not doing anyone any favours, especially not yourself. And I know that sounds like a big step and a big leap, but honestly, if someone had given me a safe space and said, it's like, we love you no matter what, we are here, it would have made a world of difference. I would have probably not been hiding for so long and trying to please everybody for so long, because that's the big thing.
Just perspective from my point of view, what you're doing with your business, ADHD 360, and what you do, this needs to start really early, right? So psychotherapy in children and giving them a safe space to talk to people. Education, which is both of you, to have children be in a position where they can actually, to be brave, you've got to be disciplined. You've got to actually kind of want it. You've got to find,
you've got to know that you want
drive,
it,
and to sort of build good habits that ultimately, and then be shown, dare I say, with some hard truths. Your lived experience, the stats. But how, in both your opinion, I suppose, is it sort of changing for the better in schools and education? Because kids need to know this as early as possible from where I'm sitting, to then have the whole knock-on effect that we would all love to see for the better.
Home, for you, not a safe space.
No.
And you wouldn't have known that at the time, though.
Because it was all on you.
Because it was all you knew.
Yeah.
But so therefore, you didn't know what safety would look like.
No.
And therefore, you couldn't go out and find it because you just didn't have that reference point. School, somewhere where for a high percentage of the time you were unhappy because you weren't able to focus and concentrate.
Yeah.
So how does a kid of that age find safety to be able to then...
You go to school to learn your maths and so on. If school can also, if education curriculum can provide the knowledge of
absolutely
what you're doing from a psychotherapy point of view and so on, that's invaluable, isn't it?
Imagine showing this interview in a school.
That's what I'm thinking.
Yeah, put your textbooks away, kids. We're going to learn about life.
Yeah.
Yeah. And here's a lady who's been there to hell and back, and now has built herself back up. But let's go back and just walk that through on a timeline of where safety could have happened for you that would have changed some of that. And we don't do enough of that. And I think the key points that I've got from you so far is you couldn't find safety because you didn't know what safety was. No one was able to tell you the impact of safety on your life. Yeah. And therefore, why would you look for it? Because you were just in this norm, and this norm was shit, but it was your norm.
Yeah.
So therefore, it wasn't shit.
Yeah.
Because it was your norm. And it's only when you have new reference points to go back and look at it. So part of the journey has got to be create that somehow. This is really tricky for every child to feel safe, isn't it? In a morally sustainable, defendable safe.
The problem is, and this is what I've seen, my daughter's 17, so she's just come out of the school system and gone into college, which is an entirely different situation. She loves it, right? Primary school, I felt that, and this is from working with children as well, primary school, I feel like it's safe to a point, but obviously the ecosystem outside of the primary school, it does make a difference to the child. So that they're loved a little bit more. I feel like they're spoken to.
Posited.
It's almost like the hugging is okay at that age. They go from 11 years old, they go straight into secondary school. And honestly, I don't know about all secondary schools, but the ones I'm aware of, and it's not just where I'm from, Northamptonshire, it's beyond, because I do a lot of online work as well. They start to bring in things like roll call, which is like military in prison. They have to be so regimented. I understand to a point, but you get a child, girls and boys, that don't have a statement, that are not able to sit and concentrate. They're put into isolation. And the stigma attached to that is they're just too much work. The teachers bless them, don't have time. I'm not blaming the teachers per se, but they don't have time. So they're put into this isolation. They're made to feel that there's something wrong with them. You don't have a statement, so therefore this isn't okay. The amount of letters that I've written, I can't diagnose, right? So the amount of letters that I've written saying it is my professional opinion that this child either has ADHD or autism or a bit of both. Please can we show, and I've worked with them for over a year, so the Equality Act says, if these symptoms are present for over a year, they are potentially disabled, so we need to treat them as such and not make them feel worse. So if they need a toilet pass, give them the toilet pass. If they need time out, give them time out. This shouldn't be something they have to beg for and feel embarrassed about. And then these girls that are perhaps getting into sexual relationships at the age of 13, 14, that are looking to be loved and seen and feel like they're enough, and then sometimes falling pregnant. Let's not label them promiscuous. Let's look at what's really going on. And they fall in my chair in my clinic, and I write these letters to the parents and to the teachers, and I get back so many times, I don't really know about this ADHD stuff, from the parents. I don't really believe in ADHD. And I'm like, this isn't about belief systems. This is not a religion. This is a biological thing that we're talking about here. So we need to be a bit more on the ball with that. And also, if the teachers are saying, well, I have to have the piece of paper, it shows you how broken the system is. So when we come out of primary and into secondary, we've got a massive problem in this country. And it's really, we talked about, the sort of pandemic with COVID. I think your bigger problem is autism and ADHD not be taken seriously unless there's a piece of paper in schools. And it makes me quite passionate and angry because there's so many kids that are ending up, they leave the house with, a can of Red Bull in the morning. They're not even getting breakfast. And they go to school and they've got ADHD or autism. They can't fit in with the rest of the kids, which, again, percentage-wise, I don't know how many people are neurotypical anymore anyway. That's a whole different topic. But then they're told there's something wrong with them. And it's what I was saying earlier, wrong. There's something different about them and you're not fitting them. That's the problem. You're not fitting them.
I want to come back to something else, but just to round that one out, I firmly believe that children with ADHD do not have learning difficulties.
Yeah.
They have difficulties
learning, yeah.
And it's for the system to change, to give them the chance to learn, not to expect that individual who's biologically presenting with that challenge for them to be able to change. Earlier on, you mentioned authenticity and vulnerability. And then just then you mentioned those 12 to 13-year-old girls, sexually active.
Yeah.
In my experience, linked to the low self-esteem, looking to improve their self-esteem by being sexually active, which is the most bizarre way of improving how you feel about yourself at the end of the day. Where are you now with your vulnerability? Because you are still vulnerable, aren't you?
Yeah.
And how do you manage that? How is someone watching this program going to learn from you on how to manage their vulnerability?
Again, I think it comes down to honesty, and I think you mentioned the sort of sexual promiscuity element of it there. Self-esteem boosting, the knock-on effect of ADHD sometimes in girls, but also trauma was, for me personally, I ended up in a situation where there was a lack of boundaries, a lack of ability to read the room, is what they say now, read the room. 13, I was raped by a 20-year-old, and then later on at 17, there was a rape with 2 guys in a park as well. And I said to you earlier off camera, I kind of mistook the first one as him liking me, even though it was clearly rape looking at it now. I mean, it was definitely, there's no mistaking that, but statutory alone, but, violent as well. So the vulnerability for me is that if I feel like if you don't own those experiences, and if you don't as an adult, especially, and I do this with clients, and, some people would, I think therapists often question me about, is it safe to be so vulnerable, especially on social media where I have a reasonably large following? And, do you find that people idolise you and in the wrong way because you're sort of revealing it all? And I'd say I'd rather they see that and see a level of honesty as someone who's actually been trained to deal with whatever presents. I'd rather they see that than sit at home and think that there's something wrong with them. If they hear me talking about that and saying, it wasn't right, I was 13, I didn't know the boundaries, perhaps there's an issue here that can be spoken about more clearly with a therapist that leads into a safer conversation with your parents. if you're willing to go to someone and have those conversations. So for me to be vulnerable, it takes a lot of bravery still, because there is still judgment and there is still some, ethical boundaries that I've got to be aware of as a therapist. But it is really my mission to be as vulnerable as possible. And that's for me as well, because I think my lived experience is much more genuine and happier as a result. But I also think that we can't just look at the funny side of ADHD online. We have to go out there and be willing to tell the darker side of it as well, and bring it into a space that makes sense. Because it does make sense when you hear someone say something that is going on for you, and you go, and that's what helped me. When, especially around the sexual abuse stuff, there was no information. And the minute I started to read books that related to me, I was
just about to say it's relatability.
Yeah.
And the relevance.
Yeah.
Which is, like you said a couple of times, someone watching this, a young teenage girl, which you've been.
Yeah.
So you can very quickly go back there from an empathetic point of view, rather than I can only imagine.
Yes.
Regardless of your sort of professional accreditation. The misdiagnosis interests me. So you were misdiagnosed.
Yeah.
You have a business that sets about diagnosing, and there's chronic waiting lists. There's all sorts of people that might not even be coming forward, but are masking, hiding. Do you see a lot of that in what you do? And what scares me is probably the people that neither of you see, that are just suffering in their life, and they might be masking it with alcohol, drugs.
Yes.
And the awful side of that is they could be hiding and then not be seen again. They could do the worst and take their own lives. What needs to happen there to get more people to sort of almost be curious, try and find out, and to actually reduce these sort of the barriers, if you like, to being diagnosed?
And the problem we have in achieving that is then we get the outcry. Everyone's got ADHD these days.
Yeah.
No, we've encouraged people who really need help to go and get the help they need. Let's not shut them down and say, oh, you can't have ADHD. You've got an A level. You can't have ADHD. You're a happy person. If we're encouraging people who've gone through your journey and others to go and seek the help they need from a tender age, not wait until they're in the 30s and 40s to get that help, then we've got to actually build a system that can accommodate this. Because if not, we're accommodating them in systems that are inappropriate. A drug rehab clinic isn't the place for someone with ADHD. The place for someone with ADHD is in their school, their career, their home, their life. And we have to say to hell with the cost of this for another ADHD clinic, because it's a damn sight cheaper than what you've been through, what others have been through, in every way of defining cost. So passionate now, can you tell? We've got to make the difference and accept as a society there is a cost of not treating ADHD, and it is far higher than the cost of treating ADHD.
That's what I'm picking up. There's a cost of missed opportunity in life. That is
absolutely
a great example of someone that has come out of almost their own prison cell, if you like, to then flourish and thrive. So many people clearly don't. That's what really frustrates me.
It is, and you've got out, and the concept of, and for a woman, like you mentioned it earlier, originally this was about boys, then it was only about children.
Very true.
And now it's about adults and children. ADHD doesn't respect gender. It's just there, and it doesn't respect anything. You can be any person and have ADHD, and yet the books for so many years were telling us who couldn't have it, and yet we're all stood there thinking, well, this is wrong. This is absolutely, it doesn't finish at 16. The moment you get spots, you don't stop having ADHD.
No.
And we're in a massive society catch-up now.
This is where the parents that you're saying with the children that come to you is saying, oh, don't blame it on the ADHD, or I'm not sure about this, because they're not educated.
They're not educated on it.
It's a simple thing, education.
And this is what hopefully this series starts to break down.
What we're doing here, right?
And then we have to switch. I think we switch the optics ourselves. We've talked about your trauma, your loneliness within yourself, your self-esteem, and the things you did to get that dopamine buzz and to get that, some of those critically not good, some of those against society's norms and values. What brings you the joy now? Because you walked in this room, you're bouncing, you're laughing and giggling. What brings you the joy? Because I want those people who are in that middle of that trauma side of things to actually see the light at the end of the tunnel.
That's a very good question, and I'm glad you've asked it, because there's a couple of things that I want to say before I answer that question. One is, on the misdiagnosis of complex PTSD, I think one of the things to say there is most people with ADHD are going to experience trauma, either because of the way they view themselves or because of the way they don't manage their emotions.
It is traumatic.
It's traumatic.
And
emotional dysregulation is a really traumatic thing. The people around you, usually in your family, may also have had problems regulating their emotion, which leads on to violence in the home, be it shouting, physically or sexually. So that's really important to say that's why it's been so hard to pick up on, because trauma's been the thing we've looked at, not ADHD. But actually, we've said that at the beginning. I think that there's a genetic influence there. But on the joy thing, I think one of the things that I do remember very vividly is I've always had that part of me. I've always been someone who found joy in connection and people and faces. I love faces. Like, I really love seeing someone smile. It's always been, and if I connected to them, annoyingly so for them, I'd want to tell them everything. And, whether it be about a butterfly brooch I had or a new toy, it would be just that massive rush of endorphins and dopamine through connection. And I still have that now. I still love people, and I still love faces, and I still love connection. And I think some people may not feel that way, that they're not so confident around people, but it's just tapping in. I mean, some people find that in books or films or whatever it is that works for them, but I find that in faces.
Your joy's in people.
Yeah.
And it comes as no surprise, therefore, that you're in a people-related industry, aren't you?
Yeah, and it is love.
Yeah, and I take it work brings joy.
So much, and I just feel that like the luckiest person alive. And I don't say that without any, I'm not over the top with that. I think the people that sit in front of me are a gift. And they don't know that when they walk in the room until they get to know me, and then I think they realise that it matters.
Yeah,
it really matters.
But you're so good at what you do, and because you are that person that's, I guess, guarded until you can let them know how you really feel. I'm thinking from a patient's point.
Yeah.
They'll go away knowing that you've got their best interests at heart and you're helping them, which, as we said earlier, helps you. Yeah. It's awesome what you're doing.
Yeah.
I'm conscious of time because we could talk to Ella for a lot longer.
And Ella could talk.
So much. I've found this conversation really fascinating and learned lots from both of you, actually. So thank you, Ella.
Thank you.
Thank you.